you. Thank you. Thank you. Welcome, everyone. Millie is our co-host today, so please do look out for people coming through, because I don't think I might have time to look in and admit people. Millie, I know you're the project lead for this project that we are doing. For those who know Mind, Body and Soul, it's for mental health in Black and ethnic minority communities. We have about 7 objectives, and under each objective, we have a project that we run each year. So in Mind, Body and Soul, we have objectives on mentorship and community connections. So mentorship, community connections will cover what you have seen in terms of police expos that we do every year with young people. That falls under our mentorship and community connections. We have an objective on mental health and well-being in children that will cover our annual mental health awareness every October, continuity with one-to-one sessions that we offer people as an organization. We have an objectives on understanding autism and learning disabilities in Black communities. That's the one that we are going to cover today, and our project lead is Millie Chiyemba, and I'm the project manager for it. So there's a few things that we want to capture today on that one. We have men's mental health that is in the pipeline, and we are looking at setting up some activities for men. We have women's mental health that we are going to do in April in partnership with Wardin, Swan and other organizations for women. And then we have families, mental health and families, areas that we also cover. We have international mental health that we cover in Uganda. But for today's meeting and today's getting together, we want to cover our objective on autism and learning disability. I don't know, Millie, if you have anything to quickly say and introduce this before I go through the strategic planning, because I've organized for at least 1 hour and 30 minutes, so we don't take lots of time from people. Millie, do you want to unmute, or are you stuck? No, we can't, because you're still on mute. We can't hear you, you're still on mute. While Millie is trying to unmute herself, I think she's having a few problems with her laptop this afternoon. I just wanted to mention that the objectives for autism and learning disabilities, it's something that we started taking on since last year. So some people might have attended a few Zoom sessions. And what we were doing at that moment, we are trying to cover a scope of trying to understand what is happening in our communities around autism and learning disabilities. We wanted to meet families who are going through that, but also share some of the experiences that we're going through and put something in place in terms of how we can support and manage that. So we had a few Zoom sessions in which we really just collected data and information about this, and met a number of families, mainly in Liverpool. Lots of people did attend, because we had about 3 people from Scotland, a few people from London, a few people from Manchester, but it was very much to do with sharing experiences at that moment in time. We used it as a safe space where people could talk about how they feel and talk about the experience of parenting children with autism and what they've gone through and what their children have gone through. It was a very good experience for us, because we got to know families, people got to share, people got to relate to what others are going through. But also what was important is that we actually got to pick up on certain things that certain families had missed out. So there are certain things that families were entitled to, but had actually missed out because they didn't know about it. So we did a lot of knowledge sharing. we captured a lot of our going through paperwork, things like educational support care plans. You know, people had them and they didn't even know what they mean. Things like social needs assessments, you know, we had to go through that and support them, but also advocate for people during meetings and that kind of thing. I don't know, Millie, if you're able to unmute now, and because I know that was your area. So a lot of parents were introduced to, you know, to us, but we struggled a bit. And we actually had to come to put it to an end at one point, firstly because I was getting married, so I didn't have the time, but also what we realized that we needed a bit of structure. Apart from structure, we needed time, because time is a vital thing for everything. We realized that the parents we are seeing had a lot of backlog that they needed us to cover, but the problem was we didn't have the time and resources to be able to do what we needed to do. So we went away, myself and Millie and the rest of the team, and then we decided to think of how we can move forward with this project. So luckily enough, we wrote a project and we got it funded, and the next step was to actually find a setting where we can be able to sit and meet our the families that we are working with in terms of parents, but also set up activities for the young people. Millie has had to set up some outdoor activities for young people where they went away. And I think I shared on our website in the beginning, we got families of children with autism and their siblings, and they went away. And it was also mainly to help us understand the activities that these children enjoy. It was outdoor. They spent a day there, they enjoyed themselves, and there's a minor report that was written. And it's a shame that Mary cannot unmute, otherwise she was there, she supervised it. She would have given some feedback on that, but once her computer is able to unmute, I think we can get some feedback from that. Hi, Millie, are you able to unmute now? I can see you waving. Yeah,
can you hear me?
Yes, thank you.
Oh, finally. Hi, everyone. It's so good to see you all. My name is Millie Kiyemba, and I'm sure many of you know me. I'm so glad to be here, as usual. So, what Justine has asked me to talk about over the summer, we did a lot of wonderful activities with families in Liverpool. Uh, we went on to the ice cream park, and the kids loved it. You know, some of the kids didn't even want to leave. So it was one of them days. They organized it for children with special needs. So it was really calm, relaxed. There was no pressure. And we had about 3 hours to ourselves without the public. So it was really a good thing. We've also organized bounce days where we've gone in for indoor bouncing. Some kids didn't like it, but it helped us know what activities kids love so we can concentrate on the things they love. However, some others enjoyed it. We've also been in touch with families to see how they're doing and see how we can improve that, because as you know, our children are different, they're into different things. So it's going to take us some time for us to know each individual family in order to meet that particular family's needs. So that's what we've been up to during the summer, really. Most of the work we've been doing with Justina is more of research of how we can actually better this for families, uh, how we can be more family centered. So if you come to us, for example, maybe your child has autism, it won't be the same as my child. So we can plan something that can meet your family needs, which is, I think, the essence of this meeting today. But I'm really happy to see each and every one of you. And as we go on, I think I'll probably come in a bit later. I'll let Justina continue. Thank you.
Thank you, Millie. We've got so far 11 people here, and I think I just want to welcome our trustee. Mr. Enoch Chiaga is one of our trustees, so if you can put your cameras on. I know we have two board members here, Juliet and Sarah. just put your cameras on and wave at our, the people that, we work with in Mind, Body and Soul. That would be useful so that people can know your face. We are a governed organization. We are registered charity now. So we've got trustees and we've got board of governors and we've got a CEO who is me, and then volunteers below that. So if you get a chance and you're a trustee or a board of governors, please do put your camera on. So moving on, as I said, we needed capacity, we needed resources, we needed so many things to do that we actually did not have at that moment in time. So at the moment, the reason we called you here is because we've managed to get some resources, and we have put in something called an asset transfer bid to Liverpool City Council, because there's a building at the moment. It's in L5, and it is an council activities center that was used by Liverpool Council, but it's not being used at the moment. And they are looking at a registered charity taking it on. So we've put in for an asset transfer bid, and we are trying to bid for this center. And when we get this center, because the first thing we need is the space, we are waiting because they said 4 to 6 weeks. So once we get the space, there is things that we looked at, apart from simply activities that Millie has been aligning to each of the children that we needed. We have to use this center for 3 areas that we are looking at. So we've got the areas of educating, we've got the area of challenging, we've got the area of advocating. But these areas are all to do with being culturally sensitive about learning disability and mental health in us, people like me, people of color, people of African origin. One of the things that we discovered during our summer activities was a lot of parents like us who have children who have learning disability, autism, or even mental health issues, isolated because the children are judged. So they cannot go out to churches, they cannot go out to communities activities because the condition of their children is misunderstood, and parents almost feel isolated as a result. Then parents are stressed, depressed, and going through all sorts of things that, we discussed at that safe space. So the biggest part of us having a center like this is having a safe space where we can all meet, but in a culturally sensitive way, because we were meeting on Zoom, but I have been able to speak to people that I have not even seen face to face. So for me, I would benefit from us seeing each other face to face. Have aligned some needs. So we have drawn a form that Millie will be sending out to parents, and it's covering areas of autistic needs, mental health needs, family needs, and ADLs, activities of daily living. If we collect all that information and put it together, it will help us understand your child better, so that when the activities center is open, it's not going to be tomorrow because we are looking at a time frame of 8 months, but it's us being able to collect this information so that when we start doing this work, we are doing it properly. We are doing it properly and we understand your child better than anything else. I think the problem is that the children are misunderstood and they do not feel part of the communities that they live in. So the biggest thing about it is all inclusion when we start these activities. So in terms of educating, we'll use the center again for education in terms of seminars, in terms of conferences, talking about mental health and well-being, talking about autism and learning disabilities, but also family interventions to share. We want us to meet there as families. We'll share, even if it's a cup of tea, even if it's a meal, but we'll share experiences and what we are going through. It was amazing during summer that, one of the parents came across and said, I don't know what to do. What I'm going through is really hard for me to cope with. And it was other parents who were actually saying, you can do this, we are in this together. They were sharing coping mechanisms, they were reassuring each other. But when you're on your own, you're not able to get anybody reassuring you or supporting you in that. So we want to use the center for that. And then in terms of advocate, we have been able to get we have a social worker attached to our organization. We have mental health nurses, and we have a culturally sensitive therapist that I have been able to meet. And very soon I will also introduce her to the team and get her interviewed by our trustees and all that. But this person deals with culturally sensitive bereavement and support for families. And I think that people from my background, we go through certain things that will not totally be understood by a white person. And I'm saying this because I've been working in health for the last 20 years, and there are certain things that they will not understand about our children or about us. And yet, when you find somebody from your background and of your color, they might be able to relate to that. It might be as simple as your immigration status. You're going through that situation. You've got an immigration status that you cannot disclose to somebody. But then you meet somebody of your color, therapist of your color, and you can be open and talk about things like that. So we'll have a therapist aligned to that as well for family therapy using the center. So under that area as well, we'll be supporting people with education and support plans. I had a bit of a backlog in summer because I was having so many parents coming to me with education and support plans, and I got overwhelmed because I was doing it on my own. And I felt sad because for some, I would even let them down. I would do it either halfway and then say, well, take it back to the social worker to do this and that. But on this occasion, this will be covered for somebody to do it for you and support you through it and complete it. So we will also have a social worker. That social worker will also do social needs assessments for people. When your local authority completes it, then you can bring it to us to go through it to make sure that it's aligned to your needs. So there'll be allocation of somebody doing something, but doing it in a lean way to complete it the way you want, because in the past, we just didn't have that at all. So that will be on the advocate issue. Then on the challenge as well, somebody mentioned about, I was going through our meetings for summer about religious leaders and how mental illness and autism is handled by religious leaders. Like Millie has said, that a lot of this that we've been doing is about research and trying to understand what is out there. And somebody mentioned about meeting religious leaders about this situation. I've spoken to at least two, and it's a very individualized approach in terms of how they understand mental illness and how they preach about mental illness and autism in children. And I think for that area, I've managed to give it to one of the Black doctors that we work with. He's part of the Royal College of Psychiatrists. He's somebody that I want to look at it. He needs to look at it in a deeper way, and probably I'll invite him here one day to deal, to discuss it and see how we move forward with that. But those are the three areas that we want to cover. In the next steps, we want to be able to start by Millie and the admin team being able to reach out to families again, supply documentation that we need. So it's a lot to do with information gathering, while in the background, we are also organizing this center that we've talked about. I am about 80% that we might get it, because we need it for the same activities that the local authority was using it. It's not in use at the moment, and we've got the funding for it. So I'm 80% sure, but if we don't get it, then we'll still look for another center that will be useful for the needs of our children. So that's where we are at the moment in terms of our next steps and what we want to do moving forward. Millie, I don't know if I've missed anything or anything that you want to add, and then we'll take questions.
Hello.
Hi, I can hear you.
Hi everyone. Just in addition to what Justina said, so myself and a team of other people will be coming to you, like she said, obviously, to collect information. With your permission, it would be much better if you allow us to come into your homes, because sometimes all we are coming to do is to introduce maybe ourselves to you if you don't know us, and then you tell us what we can do for you, because that way we'll get to know the needs of the child more, because it's about the child, it's about that particular family. So once you tell us what you need from the system, then at least we have a starting point. So for example, if your child is not being supported well in school, then at least we know it's something to do with school, so we need to be tackling the school area. So that's pretty much what we'll be doing, coming in to you, coming to your homes, or maybe a phone call, and then just be as open as possible to us, because at the end of the day, it's about supporting one another. One thing I've noticed personally, uh, with my child, I was just telling someone today that I'm quite impressed by what my child can do today, but this has only been possible because I've accepted support. Last night, I asked him randomly to go and get his pajamas and get ready for bed. Now, usually Ethan will not go to bed if he's on a gadget, but I'm quite impressed. The minute I said it's bedtime, he switched off the computer. He went upstairs to his bedroom, grabbed his pajamas, came downstairs, dressed himself up in his pajamas. Then I asked him to go and brush his teeth. And he actually went upstairs, did that, and took himself to bed. And I was really, really impressed because my usual Ethan wouldn't do that, He's so obsessed with gadgets. But of late, we got support from the local authority. He goes out with a direct payment worker. So instead of being indoors, someone comes to my house and takes him out to play. And in that time, he doesn't have a gadget. So the minute you mention Paul, because Paul is the guy that takes him out, he doesn't want the gadget. He just wants to go out. And in a way, I feel like it's really worked for us as a family, even though before I was like, oh my God, I don't want social workers involved. They're going to pick on this, on that. But it's actually come on as a positive thing for us as a family, because every single time they take him out, it's it's good time for us to spend with other kids as well. It's helped him out to detach a bit from the gadgets. And at this point of time, I've actually asked the social worker to increase his hours, and she was pretty happy with that, which I thought would be a struggle. But sometimes it's worth trying. I don't know how I can emphasize this. Um, I know social workers or this local authority has this negative name, obviously, but there is actually good things out there, especially for families with special needs. So there is a lot of help we can tap into, but we can't tap into it unless people know our problems. So we have to identify our problems and be able to get that support that we need. Okay. So that's it really, because I'm just really impressed by what Ethan can achieve now. Yet before, the gadget was everything. The gadget in bed, gadget to eat, gadget to shower, gadget. But he can stay a full day without a gadget only because he's had that outside support of people coming in to help him, which I never really thought I was entitled to. So we will be coming out. Even if you need something simple like as an appointment with a doctor, we can actually reach out to the doctors and find out for you maybe why is the appointment taking so long, things like that. Speech therapists. It could be activities. There's some activity centers that we know that can be beneficial to some children. There's a lot of things that we can actually tap into that we don't even know. And as soon as you get that support, it will give you relief as a family. If you're a single parent, it will give you so much relief. You can have some time to go out. We will be having some groups whereby you bring the kids and then you can have some time to your own. I'm sure Justina will mention that probably in the future. There's so many things that we can actually do and be able to have a happier family time, if that makes sense. So if we can minimize, because I know when you have a child with special needs, sometimes it can be really traumatizing to go out in the community. But with all this support, we will be able to overcome certain things and then also be able to tap into that help that we need. Thank you.
Amazing, amazing. Thanks, Millie. Millie, do you mind if we can just share a little bit of the beginning where we started at Ethan in terms of paperwork?
Oh yeah.
Yeah.
Oh yeah. Oh, that journey. It's been a really rough journey.
It
I
is.
remember when I started, I reached out to Justina, um, and everything was just going in the opposite direction for us as a family. There was a lot of crying. Ethan was getting so out of control. He was hitting out at his brothers, and I just didn't know what to do. I remember there is a time I called social services myself because he nearly pushed me off the stairs when I was pregnant. I called social services in tears and told them, you know what, I can't deal with this boy anymore. I really need support. But even at that time, they didn't give me the support. So I reached out to Justina. Justina helped me to fill out all the forms.
But in terms of
For
filling forms, Millie, if I can just mention, the paperwork is so big, and majority of us, as I can put my hands up because I've done community nursing in the past before I went the road I'm going to. You look at a pamphlet of paperwork that you have to do for somebody, you just dump it to them and say, that's, you know, that's your paperwork, you can fill it in. But majority of us don't know what to fill in. And what we support you with in this organization, we handpick for you and fill in those areas that are necessary, that are important. But also, if it's been done for you by a social worker, we go through it and challenge it, and also be able to present it for you in the way that makes sense, in the language that they will understand. And sometimes you wouldn't know that language. So sometimes when we ask you some questions, you might come to the center and we ask you some questions, or I might call you and ask you something. It's not me being nosy, it's me trying to present your case in a way that will be understood. Confidentiality in MBS is well understood because every professional that we work with, I'm a nurse with a PIN number. The social workers have PIN numbers, and those who do not have PIN numbers are also guided under the Confidentiality Act. So you will not find your information out there in the community and being talked about. We know the Accountability Act, we know confidentiality. So when somebody asks you for information, don't worry about what they're asking you. Be open and honest, because that's the best way we can help. I don't know if I've left out anything, Millie.
no, that's pretty much everything.
Yeah. So I think we are happy to take any questions about the project and what we are going to do moving forward.
Excuse me, Millie, I've got a question.
Yeah.
And my question is, when it comes to paperwork, what kind of paperwork are you talking about?
So I will answer that one. Is it Aziza, your name?
It's Aziz asking question.
Hi, Aziz, I'm Justine. So when your child is diagnosed with autism, mainly the diagnosis is between age 3 and 5. So we start to look at your child's needs at that moment in time. So when you start looking at your child's needs at around 5, your GP really, if your child is severe autistic, nonverbal, your GP should be starting to align with local authority. But most of the people, GPs don't even bother about that anyway. They just leave it to the school and see how the school will do it. So the school will probably do a statement for your child at that moment in time. It might be 1-to-1, it might be it might be your child is under support, but not well balanced there. So when we talk about paperwork, when you come to tell us about your child, it's about the age and the stage that they are at. Having worked in NHS for all this time, I'm aware of what is needed at what stage of your child. So that's more likely what we did a lot with Millie, if you don't mind, because I know you've talked about your case. Knowing that this child is 9 years and this is what they need at this age. So it's about looking, Aziza, what have you got at this moment in time? What has local authority offered you? Sometimes they offer you the minimum because all they want is not to do paperwork. So we look at what you have at that moment in time, and then we support you with what you need at that moment in time. Does that make sense?
Yeah, it does. Thank you so much. Is it, because for now, we've done like educational healthcare plan. Are the forms you're talking about different from that, or they are all the same?
Say that again. You've done the educational healthcare plan.
Yeah. So the forms you're talking about, are they different from that, or they are all the same?
They are all the same, but what we like when we work with you is to see the education support plan that they've given you. Okay. Then we look at the needs of your child, because local authority is good at giving you the minimum. It might be that your child needs more than what they've given you, and then we push for more. That's, that's how we do it. And sometimes they have even given you probably nothing, but there's a document there that you don't understand. So it's about looking at what has been offered to you and what your child needs. But it's the same.
Okay, I get you now. Thank you so much.
Okay. Justina, also in addition to that, so normally an educational healthcare plan is a document that has information about your child. So sometimes they might put in information like general information. So it's really up to you, the parent, to identify what your child needs, because this plan is followed by all these, it's followed in school. So for example, with me, initially when I had that document, I didn't really know what to put into the document because I thought the professionals would deal with that. I didn't understand that actually me as a parent, I can decide what I need, what I want for my child. And Justina really helped me identify those things. So sometimes when I go for the meeting, I'm already prepared. I know what I need. And a lot of times I've invited Justina in the meetings, and then she will help me to ask the questions that I can't ask them. Or maybe if they are not giving Ethan the support he needs in school, then Justina comes in and asks the questions. And I really enjoyed my previous meeting because she really challenged all the professionals and they just wanted to take her on board for the school, And to be honest, you don't realize how much information needs to be in that document for your child, but no one will tell you, oh, maybe, because imagine the teachers work with our children 9 to whatever, 3 o'clock. So some of the things we shouldn't even have to mention them because they know, because they work with the children. But it's really up to you, the parent, to identify those significant things for the child, and they will actually put them in place once they're in that document. Also, some of the other things we can do, it could be maybe appointments. If you want us to come with you to appointments, for example, if you want us to come for meetings, that someone can come with you, because in that moment it can get actually emotional sometimes. I used to really hate it when they are talking about Ethan, and it really helps me when someone is there to ask the questions for me. Sometimes I've got the questions me, but I don't even have the strength to ask the questions. So if you go with someone, they can actually think ahead of you and ask the right questions to the professional. Because like a pediatrician, you're not going to see a pediatrician every day. You might not see them in like 2-3 years. So this one time that you see a pediatrician, you need someone that knows the right things to ask them. So at least you know your child is on the right path. Thank you.
Thanks, Millie. I think the biggest problem is that a lot of our children are just part of statistics. That's how health professionals look at them. So I have read certain educational support plans and they're very generic. You know that they're not individualized. You know that they've been copied and pasted from somebody's. And sometimes, surprisingly, if you read it deeper, because it's more than 15 pages, you might even find another child's name in it, because somebody has not actually sat down to do the job that they're supposed to do. So we do not want minority as we are in the Northwest, we do not want our children to just be part of statistics. We want them to be seen as individuals, and we want them to get the best that they can get out of these services. Because I know that if we offer them the best that they can get, we can also get the best outcomes from these children. We've already had Millie giving an example of, Ethan at the moment doing things for himself independently. He might not do everything that you want him to do as a parent, but he can move from literally a percentage that they gave him in terms of optimal, living to a better stage in life. And that's what we need for them. That's what we need. Any other questions, please? Questions, comments? We have 15 minutes before we go. So any questions, comments?
And just to say that, thank you for the great work. That is so interesting. It's really nice because once you have that and then the families get to know what you guys are doing, I think, and they take you on board. There's a saying that you snooze, you lose. So if they don't know about you, they're the ones losing. As long as they know, they are benefiting. So it's good. And also what you said about that building whereby there's a committed space. Yeah, once that comes into play, I think that would be so, so good as well. Yeah, so well done. Great job. Keep on keeping on. Yeah.
Thank you, Juliet. Thank you. I can see that Stella has just joined and we are almost finishing. So I don't know if there's anybody else with a comment or a question about what we are doing.
Maybe just to mention, because I've just talked about people knowing about us. Mm-hmm. Maybe we can just think about how to let other families know. Yeah, because there's so many families that might not know that this support is out there. So if we just do a bit of research, how can we let people know? How can we, let people know that we are there, to be honest.
I had a bit of struggle. That's really interesting that you've said that, Juliet. I started mental health sensitization in 2014. And mental health, autism, learning disability is a very sensitive topic. It's not something that we speak about openly. So for many people who know me, I went straight onto YouTube and I used to do YouTube videos about mental illness, autism. I used to do Facebook Live, and it only became a word of mouth. So when I supported a family then told another family, and a lot of people that I've worked with, the first question families ask them, isn't she going to talk about me and other people, and isn't she going to talk about me and my son to other people? So as time has gone on, people have began to trust me and know that there's confidentiality, and they believe in me. And sometimes I'm in my home environment and someone rings me, oh, Masawa, I need to come and see you about something. So working with people is that complex, especially people of your own community, because they know that you are within that community. So I'm Ugandan, I relate to Zimbabweans, Gambians, Nigerians, and any time that I go to a conference or any of those areas, I will find somebody that I know. I recently went to London to the British Science Museum for a leaders conference, and I found 3 people that I'd worked with in London a long time. So it's one of those things, Juliet, where it's a word of mouth and people need to trust who you are to be able to open up about that. So we will continue to advertise. We have a website. I normally put it on my status. We still have our YouTube channels. But again, it's the parents that we work with who would like to go back and say, this person does this kind of work and they can help you.
Can I suggest as well?
Yes, thank you.
Because obviously the objectives that you've talked about are mainly, one of them is education.
Yeah.
So so formulating a leaflet, it could be a leaflet or, yeah, mainly a leaflet, and
Okay.
drop them in schools.
Okay.
Yeah, speak to a head teacher and say, we are providing such and such a culturally sensitive service for Black families. Please, if you find any family member struggling with a child with autism or learning disabilities, we are here to help. They will definitely, and this is the way you can refer into us. So I think a leaflet in schools, especially around education, yeah, I think that would be sufficient for now, and then we can look at other ways of advertising. But definitely very useful service that some of us didn't get when we needed it, but now that it's here, so let's advertise it that parents can benefit.
Thank you. Thank you.
Michelle.
Yeah.
Hi everyone. Just to add to what Julia's just said, especially like today's meeting, I found it very vague. It wasn't really clear what we were attending. So maybe just being as simple and as simplistic as possible, because not everyone will understand the jargons and everything. So just making everything as simple as possible. We are here to help, we are here to support. What's the meeting all about, just making it as simple as possible.
Okay.
Yeah.
Justina.
Yeah.
It's Michael. To add on to, or maybe to, how can I put it, to encourage Sarah and Juliet, I believe that we should actually keep our eyes open. And when we see people who actually require help, we should then maybe approach them ourselves and let them know that there is a service which can be of use to them. Because as you know, most parents are very, very shy and hide this away. In the London community, I was talking to my auntie yesterday, and I say there's one guy I respect because although I know many people who have children with autism, from the very beginning, he always brings his son within the community. Most people try and hide their children with autism away from the community. So in our daily lives, if we see people who may have issues or children, maybe we should take it upon ourselves to approach them and let them know there's a service out there for them as well. And that personal touch may be much more easy for them, rather than just having leaflets and information pushed at you.
Mm-hmm.
So we also try and sell the service that we provide.
Exactly. Thank you, Michael. Exactly what you're saying, because Justina says one way of advertising is word of mouth, which we are all, we will do. And then I also suggested another way, because you don't only have one way of advertising, you need to have several ways of letting people know that you're providing a service. Okay, so the other way that I suggested was coming up with leaflets and distributing them in schools, because there are people that we are not going to meet, but maybe they will benefit from the service. So if they have that leaflet that is passed on to them via school, I think that will also be beneficial. Thank you, Michael.
I'm really sorry because I cut off. So
There is another person, Zoom user, with a hand up. Did you want to come off and say something?
Hello.
Thank you.
Hi. My name is Richard Kiyimba. Hello, everyone. I'm happy to join this meeting. Justina, thank you so much for this platform. Actually, we are one of the beneficiaries of MBS. Hello, can you hear me?
yes, we can, Richard.
Yeah, and I just want to extend my thanks to Justina. She's been really there for us with our Ethan. She's been so supportive. As Millie mentioned, she's been attending our. She's helped us attend many meetings with the professionals just to identify our needs. Because in many cases, you really don't know what you need with your son. You might know, but there's some things you might not know, or you don't know how to access them, or you don't know whether you are entitled, not entitled, but you're supposed to get to get that kind of support from the authority. But Justin has been there to help us identify um, some of those things. I thank Justina for being there really for us. We appreciate. We can see a very big difference with Ethan. He's made lots of progresses in this journey. We are very thankful. Thank you. That's my word.
Thank you, thank you. I think my my laptop lost connection, so I'm on the phone at the moment. Millie, do you want to take over the meeting, or do you want me to continue?
Thank you, Mr. Chamber. Just in addition to what Michael and Sarah and Juliet have said, we also intend to, with the flyers obviously, and we intend to reach out to community groups. So we do realize there's a lot of stigma in our communities, especially in the Black communities. Like people still have this tendency of, you know, saying so many things about these families and then making it even worse for the families. So we intend to reach out to communities more so we can raise awareness. So when families are out there, they don't get receive that harsh treatment or people talking behind their backs, or just, I don't know, some people say things like, oh, that child is too stubborn, meanwhile the child is suffering something, you know. So one of the things we are planning actually to take on is reaching out to communities. There's so many opportunities we will be getting in the communities as well, not just in Liverpool, but in different areas, so people can get to know that actually families are struggling. So instead of making it harder for them, we can be a helping hand to those families. Because sometimes when you're struggling with a child, you don't even know yourself what's going on with the child. So all you need is support. So that's really one of the other things that we plan to do, reaching out, but we will also take into account all these other points that have been mentioned.
So that area will very
Thank
much
you.
fall under our, can you hear me?
Yes.
Sorry, thank you. So that area will very much fall under the educate kind of bit. So for many times we've been invited for conferences in London, Manchester, Derby. So we will start again the traveling and being able to educate and share experiences. And I do like to call upon mothers who have gone through such experiences. We had that safe space. And sometimes there's nothing that educates somebody like your own personal story. So if people are happy to tell a personal story, please do come along with us. Instead of us giving evidence-based and all that kind of thing, share your story so people can learn from it, because that's the best way for people to actually be able to learn from these situations, because it's live learning. You're experts by experience. So do share your stories when that time comes for people to be educated. Thank you.
Justina, also, I know Sarah mentioned us being more clearer. Just to mention to everyone, today was mainly our planning so we can hear more of what you have to say. So just feel free to say whatever you want to say, because we are actually taking notes so we can bring those things to life. So if there's anything that you feel like would be beneficial to families or maybe to yourself, or just feel free to tell us what you think.
Absolutely. It was
We'll
just
move us
about,
forward. Thank you.
strategically planning the next steps. That's why we didn't have a topic as such, but it was just about how do we then strategically put this into action that we've got. And we've got these or is it new hands? Yeah. Is there anything else in the comments, Millie, that we can pick on?
There's nothing in the comments unless people are talking on mute.
Okay. I can't see much because I've moved onto my phone. The laptop is gone off for some reason. So I can't see comments and I can't see the whole gallery. So if anybody has another question or comment, please make it. Otherwise, we are running out of time.
Yeah, one other thing I want to talk about is what you just said, Justin, about the personal story. Yeah. Whenever I talk about Ethan, all the challenges we've gone through, I really feel like I'm healed. I'm kind of relieved. I feel like happiness in me because we have something to talk about, maybe that can help somebody else. So please, if anybody has a story to tell, you just be free to talk about it. It will kind of give you that healing within you and maybe like relief. That kind of relief where you feel like you're not by yourself. There are other people who are facing those challenges, and yeah, it kind of helps. Yeah, thank you.
Thank you, Richard.
Welcome.
I think it's a Sunday evening, and if nobody has anything else to say,
can I say something?
Oh, go on, dear.
Sorry, I'm very far, I know, but I think you need to have like more of these meetings for people to like be aware, to kind of like open up, because as you say, there's so many people, Black community, who are facing all these, but we kind of like shy to like kind of come up and open up. But I think the more you put awareness out there and the more you advertise, I think you'll find that there are so many people who really need your help. But thank you so much for all your help that you do.
Oh, thank you, Terry. I think we've had all these running, and I said I was quite selfish around June because I stopped doing it to organize my wedding and everything was overwhelming. I've done it since 2014. So we will be back onto Zoom and teachings under our principle of educate. We will be back traveling, England, to be able to educate people in conferences, seminars, and any presentations that we'll do. So definitely we will be back, and thanks for your support.
Or if anyone has a question that you would want more light on.
And I'll be asking Millie to close as well, please, if there's nothing else, if you can give us a closing word, and then we close. And we will be we have a safe space group. So if anybody wants to be part of the safe space group, it's a WhatsApp group. It is closed, it's a closed group, so we don't share things from there to other people unless it's been agreed. So if anybody wants to join that safe space group, please inbox me or Millie so we can add you onto it. Otherwise, Millie, if you can close the meeting and then we'll be done. Thank you everyone for being part of today's meeting, and we'll be communicating the next upcoming meetings in terms of this project. Thank you.
Thank you.
Thank you.
Thanks, everyone.
Hi, everyone. It's just a special thanks to everyone. Oh, go on, Catherine. Sorry. Catherine, did you want to say something? Okay, I think she was saying hello to us. I just wanted to say a special thanks to each and every one of you for attending this meeting. We will be having many meetings in the, obviously, like Justina has mentioned. What I would encourage each and every one of us is to reach out really, because even just you referring someone to us, that might just change their lives completely, because it just takes that one person to reach out to that family or to that individual, and you won't realize how much impact you've made until when that person comes back to you and be like, you know what, I feel like there's a change in my child's life, there is a change in my family and that particular individual. So let us reach out, because there's so many families struggling with this, with a lot of learning difficulties. It's not just autism actually, because currently I work with special needs, and sometimes I go out and I'm like, dear Lord, what exactly is happening, you know? So the only thing we can do really is to reach out and help one another. If you see a struggling family, sometimes it can just be a simple gesture of just helping that mother, maybe with a child, maybe with an evening. You don't realize how that will change someone's life just by helping them, even if it's an hour, even if it's just. So let's just really reach out. That's all I can say to each and everyone. We will be reaching out about other things coming up on the WhatsApp group, reaching out to you, like obviously phoning you, um, to let you know with what's happening. Yeah, that's it really. Thank you so much for turning up. God bless you all richly.
Thank you. Thank you very
And
much.
thank
Have
you
a
to
wonderful
Justina.
week.
Thank you,
Okay,
everyone.
bye-bye.
And thank you, Justine.
Have a blessed week. Bye-bye.
Bye.